Doctors sounding the alarm on a growing trend happening at hospitals across the country. The American Academy of Pediatrics, American College of Emergency Physicians, and also Emergency Nurses Association just releasing a joint report showing emergency rooms are being flooded with kids suffering from anxiety, depression, suicidal thoughts and attempts. ER doctors and nurses are begging for help, saying they don't have the resources to treat kids struggling with mental health illnesses. Board-certified psychiatrist Dr. Daniel Bober joins us live. Doctor, thanks so much for being here with us. I wonder if you could just first kind of paint the picture of what hospitals and doctors are really seeing across the country in terms of these children and just sheer numbers, too.
Well, we know there's been about 100% increase in ER visits for pediatric mental health reasons. But, this has been raging on for about 10 years. There's been about a 60% increase in suicide rates in teens from 2011 to 2021. We also know there's a tremendous workforce shortage of child psychiatrists. 40 states and Puerto Rico have severe shortages of child psychiatrists. So it's a combination of a workforce problem and social stressors that have just really overwhelmed ER doctors.
Yeah, I can't imagine. And I also know, emergency rooms obviously can handle emergencies like heart attacks, bodily trauma from accidents, overdoses. So why are doctors saying, this is not the place for that? ERs aren't equipped to handle kids' mental health crises. Why is that the case?
Well, they're just not really set up for it. The physical space is not set up for it. They're not staffed for it. But I can tell you, as someone who works in a major hospital and works in the emergency department, these cases are coming in and it's very overwhelming for them. They want to deal with things like pneumonia and gunshot wounds, and child psychiatric issues for them can be a distraction. Not to say that they're not just as important, but they do definitely require, they take away time from other things for sure.
Yeah, and I think to that I would say, well, where are you supposed to go? I think for parents watching this segment, if they have a child who starts to present a mental health episode, and God forbid, say it's middle of the night, it's the first time for this child and they don't know where else to go, I'd probably go to the emergency room too. What do you suggest for parents?
Well, I think we need, sort of psychiatric urgent cares, if you will, where parents can take their kids when these events happen. But the kids that I see, I'll tell you, honestly, the parents just don't know what else to do. It's a behavior issue. They're cutting themselves, and they literally have nowhere else to turn to. We know there's shortages of mental health professionals. Their kids are under so much pressure these days. We talk about, why are these suicide rates increasing? Some people say social media, academic pressure, peer pressure, substance use. This is particularly true in LGBT youth and teen girls, who are really suffering the most. So I think it's a combination of a mental health crisis and, again, workforce shortages.
Yeah, and my last question to you, to just kind of, double down on that question, though, when you say we need psychiatric units for play, do those places exist? The places that parents should be taking their children when something like this happens, does that place exist for parents to go to in the middle of the night?
It really doesn't. And what the point is to try to address these problems before they become emergencies. And again, if we had more providers and we had more crisis stabilization type facilities that we could use to avoid the emergency room, I think we could cut down on this workflow. But until we have that, I think most people are going to figure that their first place to run is the ER when they don't have adequate mental health care.
Yeah. And don't you think that's remarkable that it's 2023 and we don't have a place like that for parents to know to go to take their children? Dr. Daniel Bober, thank you for your time, your perspective, and just kind of painting the picture, shedding a light on it for us.
My pleasure, Marky.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.